Hi, I'm Dr. Neilsen with Nuvia Dental Implant Center, and I'm going to be watching some videos from movie clips that show dental procedures, and I'm going to be reacting to those.
Cheers, your health. Well.
Ooh. Oh my God. So sorry about that. Just one moment. Carpe dentum. Seize the teeth.
Let me assist you.
Oh, dear. A spoon. Oh, how clever.
Spoon.
How clever. Wait,
Here we go, dear.
Wait, I've got there. Make a pincer. Come at it from both sides. Together.
There you go,
up,
darling.
up,
That's
up,
it. There we go.
up.
Very
Oh,
good.
thank you. There it is. Oh, just shake them off like a dog.
That's gross.
Sorry. Oh, forgive me.
It's all right.
Sorry about my spray. I'll be right back. I just have to reattach some with a little adhesive. Yes, and tell him to puree the salmon if you will.
Puree the salmon.
Thank you. Sorry about that.
All right, so yeah, what he or she would, what Mrs. Doubtfire was wearing is considered a flipper. Sometimes they're called partials. It wasn't really replacing any teeth. What it was doing was making Robin Williams' character look more feminine, so they whitened the teeth, made them bigger, and then rounded, because people say that rounded teeth tend to look more feminine and square teeth look more masculine, and so that Robin Williams would look more feminine as Mrs. Doubtfire. That's why he was wearing it's just a tray that actually goes over the teeth, so it's really all cosmetic, and it makes sense that it came out while he was, drinking some wine, because they're not meant to be, you're not meant to eat with them or drink with them. They are purely cosmetic. And so when he had them in there, he probably had some sort of denture glue or something to hold them in. And as a lot of people with dentures know, you take a swig of any liquid or take a bite of food, and your saliva just washes away that adhesive, and then the teeth just plop out like that. That's pretty accurate if you had some veneered teeth like that, being held in with just denture adhesive. Pretty accurate to say that if you drink some liquid or have a few bites of a meal, they're gonna come out. So yeah, pretty accurate.
No, I know, but we just need a couple more minutes of your time.
Yeah, tuck it right in there. I don't want to re-sterilize. Walk with me. Okay, here we go. Patient named Phil Lennick, 2:45 a.m. arrival. Minor concussion, like I said, some bruising, pretty standard.
Do you mind if I take a look? I'm actually a doctor.
Yeah, you said that several times last night, but really, you're just a dentist.
Fact, that's how doctors treat us. So dentists, actually, this is funny because it's got some truth to it. I think a lot of MDs will see dentists that way. Dentists actually are doctors. No, we didn't go to medical school, but yes, we went to 4 years of undergrad and then had to get accepted into dental school. Dental school is another 4 years, so it is a doctorate program. And no, you wouldn't want me working on you if you have appendicitis or if you have a skin condition, but I am a dentist, a doctor of dental surgery, so I am a doctor of teeth and the oral cavity. So yeah, it's funny though, very accurate in the judgment of some MDs to dentists. Finding Nemo, classic.
Can't hear you, Peach.
I said we got a live one.
Yes! Boy, oh boy, oh boy, oh
What do
boy.
we got? Root canal, and by the looks of those x-rays, it's not gonna be pretty.
Rubber dam and clamp installed?
Yep.
What did he use to?
Okay, so first of all, the way he's holding the handpiece, you have no control. You'd never hold a handpiece like that. No, you couldn't accurately drill anything like that. So no one would ever do that. So that part is not accurate. And also the screaming. I don't do root canals anymore here at Nuvia, but I've done many root canals before. If a patient was screaming like that, I could not continue working, and I would not continue working, and I think most dentists are the same. So the patient would be heavily numbed up before continuing on. The other thing, if he's doing a root canal, he doesn't have a rubber dam. Saliva can contaminate the root canal area and actually lead to more decay and issues down the road. So you'd want to put a rubber dam, and that's just a rubber sheet, and you poke a hole in it, and then you put it so you only expose the one tooth that you're working on to keep saliva from going in there, because everyone's saliva has tons of bacteria in there, and you don't want that bacteria to get into the clean operative site, and so a rubber dam would be necessary.
Glidden drill. He seems to be favoring that one lately.
Oh, I can't see, Flo.
Now he's doing the shoulder technique.
Oh, he's using a headstrom file.
That's not a headstrom file. That's a K-flex.
It's got a teardrop cross-section. Clearly a headstrom.
No, K-flex.
Headstrom.
K-flex!
Headstrom! There I go. Little help. Over here.
I'll go deflate him.
So from the view, I can't tell specifically if it's a headstrom or a K file, but it's funny, those are both accurate files. It could be either one. He's using it a little aggressively, the dentist is. I could see his hand moving there. So I don't think that part is accurate, but those are actual instruments. And what those instruments are, they're types of files to get the nerve out of the tooth. So yeah, it's funny. I don't remember them going into that much detail.
All right, go ahead and rinse.
Ugh, the human right.
Spittoon, I haven't seen a spittoon unless it was in a dental museum. So maybe if a dentist has a really old office that he hasn't updated, we just use suction, and we just suction it out and don't have the patient spit into a gross bowl next to their seat.
This is a disgusting place.
Hey, Nigel.
What did I miss? Am I late?
Root canal, and it's a doozy.
Root canal, huh? What did he use to open?
Gator Glidden drill.
He's been favouring that one. Hope he doesn't get surplus silver at the secondary portal terminus. Hello? Who's this?
New guy.
The dentist took him off the reef.
And howdy. From my neck of the woods, eh? Sorry if I ever took a snap at you. Fish gotta swim, birds gotta eat.
Hey! No. Those aren't your fish. They're my fish. Come on, go. Go on, chew.
And the dentist isn't wearing a mask, which of course in COVID world today would also, of course, never happen. And I hope he didn't show, but I hope he changed his gloves after shooing a bird away. He's wearing his gloves. And I don't see any of those instruments they're talking about on his tray. Any of the specific root canal instruments. So this one, for a cartoon, it was pretty good, but not completely accurate, no. I think the fish talking about the instruments he was using was more accurate than the actual cartoon of the dentist with his patient.
Loser.
Oh, sir, I saw it. Some angry member of the kitchen staff. Did you not tip them? Oh, the terrorists, they ran that way. It was a run by fruiting. I'll get them, sir. Don't worry.